Caregiving is at the core of nursing, but money matters and it motivates. $100 million, that's how much Vermont's 17 hospitals spent on travel nurses last year, double the price tag from 2020. Travelers take home between 2 to 3 times more per paycheck than full-time personnel. Channel 3's Christina Gesford is examining the pay disparity driving Vermont's nurses to leave their jobs in the middle of a pandemic. Christina, what's being done about this?
Darren, state officials say they saw this crisis coming at least 5 years ago. They've been exploring options to expand recruitment and retention, including long-term strategies like loan reimbursements and scholarships. But in the meantime, hospitals have been trying to control a bleeding system with Band-Aids. So I wanted to know, what can we do right now? Nurses on the front lines tell me we must immediately pay full-time staff more money if we want to attract or keep them here.
I work aside travelers who are great, but they are making 4 times as much as me.
If the hourly wage was better, I'm sure more nurses would be able to stay here longer.
It does hurt when you don't feel like your work is valued.
3 registered nurses working at Vermont's largest hospital with 3 unique perspectives. After working at UVM Medical Center for 6 years, Elise Legere plans to quit and pursue a travel contract out of New York City with 3 kids under 5 and a husband in tow. Despite adoring her time living in Vermont since last July, travel nurse Rebecca Call isn't interested in staying after her assignment ends next month. And Benton Taylor, who moved to a state he loves 4 years ago, has since lost a lot of his love for the job that brought him here.
I can confidently say that if I made a wage that matched the cost of living here, we definitely wouldn't have even considered leaving, because it's just a lot to uproot our family.
That's because Legere says while the Green Mountains may be beautiful and she enjoys her position, neither is paying the bills.
One wintry day, I made a snowman.
A combination of factors are contributing to her decision, including lack of affordable and accessible childcare and housing. But she says pay is the main motivator. And receiving significantly less compensation than her travel nurse counterparts can be demoralizing.
They're making really smart financial decisions for themselves, and why wouldn't they if they're able to? They're really empathetic towards us. I mean, they're not sitting there like, hey, I'm making 4 times more than you. They're like, you guys need to make more money.
While nurses like Legere are enticed by the promise of better pay, the staff nurses who do stick around assume additional responsibilities. Amid the revolving door of temporary personnel, Benton Taylor says permanent staff must brief travelers on important policies and procedures so quality of patient care isn't compromised.
In addition to just like being a nurse and doing my job, we're constantly, training these people that come for a short period of time. So then you're also training people again and again and again, and it just wears you down. It's harder to have, good teamwork when you just don't know the team that you're working with.
It's a cycle of burnout and instability that's pushing people out of the profession. In December, the Vermont Talent Pipeline Management published a survey forecasting that between today and next September, Vermont will need to hire more than 6,200 nurses in new or replacement roles.
Wonderful. Thank you so much.
42% of whom should be licensed RNs, where the need is greatest. The findings conclude filling those positions is the only way hospitals will drastically reduce their dependency on expensive travelers.
There are a lot of people in the agency that need to get paid.
Employers pay agencies $150 to $200 an hour per nurse. The travelers themselves take home about $80 to $100 an hour. Vermont's registered nurses make an average of about $38 an hour.
Sometimes it takes really a crisis for everybody to come together.
Green Mountain Care Board Chair Kevin Mullen says we have to start by raising nurses' salaries.
Now we're at a point in time where I think that people realize the seriousness of the situation and will make those hard choices.
Choices like approving higher budgets and accepting potential rate hikes, meaning cost for the patient could go up. The board regulates hospital budgets and insurance premium rates. So Mullen says his team will need to ensure hospitals' submissions are allocating resources towards effective retention and recruitment efforts before giving them the green light.
It's going to be painful, but it's going to be less painful taking the steps necessary to fix this nursing crisis than it would be if we started to lose loved ones because they didn't have access to care.
President and CEO of the Vermont Association of Hospitals and Health Systems, Jeff Tiemann, trusts providers and the state can strike the right balance.
If we can get some financial support from the state to help with those retention and recruitment costs, then we can relieve some of the pressure on the ratepayer side.
And that's exactly what Governor Phil Scott's budget proposes. Invest $33 million in a program run by the Agency of Human Services to fund recruitment, retention, and training initiatives established by healthcare employers.
Provide things like potentially retention bonuses, sign-on bonuses, or other creative and innovative strategies.
Another important strategy, expedite visas for international nurse hires. Vermont's Director of Healthcare Reform, Ina Backus, says living in a region with Boston and New York City, where a worker in any sector could make more money, creates an incredibly competitive market.
These employers have to be thinking about how their compensation keeps pace with their peers, whether or not it's reasonable to keep pace with traveling staff agencies and what they are offering is a different question.
Vermont's permanent nurses tell me they don't expect employers to completely close the pay gap, just decrease the huge disparity that's driving them away when they would otherwise stay.
As much as I don't feel well compensated, I have great coworkers, I love my patients, and I really like the culture of the hospital I work at.
Mullen, Tiemann, and Backus all agree the solution calls for a multi-tiered approach. On the state level, the legislature will need to approve the governor's proposals. And on the national level, the federal government must determine if travel agencies are price gouging. Our own Congressman Peter Welch is leading the charge to find that out. Live in the newsroom, Christina Gesford, Channel 3 News.